Well, in just over a week, thousands of teachers, kids, and parents across the Mid-South will be celebrating spring break. But before you let loose, you might want to take some time to check in on your child and see how they're doing. Unfortunately, depression and suicide rates have increased dramatically since COVID. Dr. Karen Streeter, aka Dr. K, is here to walk us through some of the warning signs. Good morning to you.
Good morning.
Why is it so important to know the difference between adult depression and child depression? Because that's a big deal.
It is. It is a very big deal, and there are different symptoms.
Okay,
yes.
different symptoms.
And so
okay.
It's very important for parents to know what the symptoms are in their child, because the earlier you can detect it, the earlier we can start treatment. Because depression is not just a feeling sad, it's actually about chemicals in your brain and the way they interact together. So the longer your brain acts depressed, the longer it stays depressed.
Some of the stuff that I was reading, you're saying that it could start as 1 or 2 years of age?
Yes.
That was shocking to me.
I know, it was shocking to me. One of my very first clients was 3 years old, depressed, and we were able to see it because this particular child who was in pre-K was beating up all of the other children. So we had to devise a specific treatment plan for that child, but luckily, because we caught it so early, they were able to come out of it in 6 months.
Okay, so you've got some quizzes. You're going to walk us through a few things.
This is to see how much you already know. Oh. How much you already know. So the answer will be adult or child.
I'm ready.
And this is about depressive symptoms, okay? So number 1, irritability and frequent tantrums. Is that adult or child depression?
I mean, well, tantrum, you're going to go child.
Exactly. You're so smart. Good. Number 2, feelings of sadness expressed through physical aggression.
I feel like that could be both.
Adult or child?
I feel like that could be both, because child, because you were just talking about the younger one, and sometimes they kind of fight, but sometimes adults do too.
Exactly.
I feel like both. Ooh.
It's really for children. Usually when adults are aggressive, it may be a different disorder.
Oh.
But because children oftentimes don't have a lot of language,
so that's
physically
they
express it. Yes, exactly.
Got it.
So, yes, so the next one is persistent fatigue or loss of energy.
Kids have way too much energy for it to be them.
Exactly.
It has to be adult.
Adult.
Right.
Exactly. And I feel like persistent fatigue is for everybody right now.
Yes.
Yes. Okay.
Yes.
So the next one is complaints of physical symptoms like stomach aches.
Ooh. Well, you know, I think kids tend to say it's like they have stomach aches. You don't really hear that from adults because they're going to figure something out for us. So kids.
Yes.
Okay.
Child. It would be, you know, mommy, my tummy hurts, my head hurts. When they continue with that, it could be depression.
Ooh.
And then finally, persistent feelings of hopelessness and worthlessness.
Adults.
Yes.
Kids don't understand.
They don't understand what that is yet, thank goodness.
Yeah.
Yes. So you did pretty well with that. You did pretty well. So let's just go over some of the behaviors that may indicate depression in children. Number 1, that irritability, that frequent frustration or annoyance, tantrums, outbursts of anger, and crying that seems excessive.
Because sometimes irritability could be because the child hasn't eaten just yet.
Yes,
or they need a snack or something. So how can you determine between child hunger or the irritability is more of a depressive state?
Right, because it's about how long it's happening, how much is happening, how deep it is, how hard, like if they are tantruming and it's so bad, they're vomiting, falling on the floor, blacking out, and it's happening all of the time. Now we're looking more at a depression versus just a childhood behavior.
When it comes to depression and talking to your child and sitting them down, what is the best one step we could take when we want to take that olive branch, say, hey, is there something I can do for you? What can we do as a parent to our child?
Well, the first thing is to let children know it's okay to feel the way they feel and to let you know.
Yeah.
Because sometimes kids feel afraid. They don't realize that they're, you know, especially when they're out of control and people are always telling them, sit down, stop crying, stop doing this. It's okay to say, I'm sad, but sometimes they don't even have the words.
Yeah.
And that's why it's so important. Like when we're thinking about adults, this is how adults look when they're depressed, sad Max. But for kids, it's Mad Max.
Yep.
when they're angry and beating up things all the time, it's not always about misbehavior. Sometimes it is actually depression. And if you believe that your child feels that way, it's always best to get help immediately. And sometimes that first person to talk to is their pediatrician. Yes, because they should have a history of your child's development, your family history, and they can look at how the child has been since birth, compare that, and see if you're actually looking at a disability versus just childhood behavior.
Dr. K, thank you so much. Fantastic.
You're welcome.
That's good information. Thank you so much for your time
Thank
this morning.
you.
Oh, that's great.
All right.
Okay, well, just ahead, Todd has your full forecast, weather forecast, plus look at how Memphis is celebrating Mardi Gras this weekend.